Hi there, my name is Cassandra Sampson and I am a registered dietitian nutritionist. Congratulations on making this commitment toward a healthier and happier you. You are prioritizing your health and we are honored to be part of your team. I just want to review a few pre-op guidelines for you to be aware of. 2 weeks prior to your surgery, you're going to start replacing one meal a day with a protein shake. Consider replacing 2 meals a day with a protein shake, especially if you have gained weight during the pre-op prep process. 1 week prior to your surgery, you will begin the full liquid diet. This is a short-term, low-carb, low-calorie diet, and it is required to help with the safety and the effectiveness of your surgery. So it's a pretty big deal. It's also required for shrinking your liver and reducing abdominal visceral adipose tissue. Another reason this pre-op diet is required is for weight loss. It can help prevent certain post-op complications when you do lose weight prior to surgery. So by this point, 7 days prior to your surgery, all alcohol, carbonated drinks, sugary drinks, caffeine, all of that has been eliminated. Once you're just 7 days away from surgery, you would have significantly decreased your starch intake and your added sugar intake as you prepare for the road ahead. By this point, you should also be in the habit of eating your protein first, eating very slowly, being very mindful when you're eating, and chewing very thoroughly. You should also be separating drinking from eating at this point. Continue to replace 1 to 2 meals a day with a protein shake for the 7 days prior to surgery. You will also begin a daily sugar-free electrolyte replacement drink for 7 days prior to surgery and at least the first week after surgery. So some goals for you to be aware of during these 7 days prior to surgery: 70 to 80 grams of protein a day, approximately 1,000 calories a day, and 50 grams of total carbs or less a day. You should also be preparing your grocery list for the full liquid diet. You definitely want to have your low carb, high protein shakes on your list. If you have a lactose intolerance, choose a shake with a whey protein isolate or a non-dairy shake. My recommendations for non-dairy shakes include Evolve, Aloha, and OWN. OWN is spelled O-W-Y-N. You also want to have milk on your grocery list, either skim milk or 1%, or you can also go with a non-dairy milk. You want to have low sodium tomato juice or V8 juice, Vitamin Water Zero, Gatorade Zero, Propel, Crystal Light, Mio, Truly Lemon, non-carbonated fruit-flavored water such as Hint, Dasani, or Nestle. Sugar-free juice can be on the list, decaf coffee and tea, non-fat, low-sugar Greek yogurt with no more than 13 grams of sugar per 6-ounce serving, unsweetened applesauce, low-sodium, fat-free cream soup can be on the list, as well as low-sodium broth. You do have the option to add a unflavored protein powder to the broth. And then you also want to have sugar-free pudding, jello, and popsicles on your list. Green smoothies are appropriate during the full liquid diet as long as there are no high glycemic fruits or foods snuck in there. We do allow cottage cheese and blended soups during the first few days of the full liquid diet, but remember, these soups cannot have added starches such as rice, pasta, potatoes, peas, or corn. Remember, the goal of this short-term diet is to help shrink your liver and reduce abdominal visceral adipose tissue. I have some tips for you. I do recommend planning out 3 structured meals a day, even if we're talking about liquid meals, in order to prevent kind of just grazing on empty calories all day or boredom eating or drinking. So for breakfast, you can have a ready-to-drink protein shake or make your own protein shake with a protein powder, a fat-free milk, and maybe some frozen berries. As a snack, you can have low-sugar Greek yogurt. For lunch, you can have a low-fat cream soup as long as it's just the cream base and everything else has been strained out. For another snack, you can have a sugar-free pudding or jello. For dinner, you can have a green smoothie or you can have another fat-free, low-sodium cream soup of a different flavor. For dessert, maybe a low-sugar Greek yogurt. So the clear liquid diet starts the day before surgery. So you're on the full liquid diet for 7 days prior to surgery, and then the clear liquid diet 1 day prior to surgery. You want to make sure that you have clear protein drinks on your list. There's lots to choose from. Premier Protein has one that's very popular. Protein 2O is another one. Bariatric Pal is a website that has hundreds of high protein drinks to choose from, and their website is bariatricpal.com. You also want to have unflavored protein powder on your list because you can mix that into water and you can mix it into broth to add protein to your diet. You also can add decaf coffee as long as it's black. There's no cream in it. And decaf tea to your list. You can add the sugar-free juice during this time. And again, the non-carbonated, caffeine-free, sugar-free drinks during this time. You can definitely have that on the clear liquid diet. All right. So options for unflavored protein powder. You can just, visit the old internet and there's lots of different unflavored protein powder options. But some very popular brands would be Unjury. Garden of Life is another one. They have a raw organic plant protein powder that is unflavored. And remember, you can add these unflavored protein powders to your chicken broth, to your veggie broth. You can add it to your water. You can add it to really anything to increase your protein. Now, I know what you're thinking. You probably feel overwhelmed, and this is a lot of information, and we totally understand that. It's a lot to read through and a lot to prepare for, but this is all helping you be successful in the long run.